Hey, how are you? I'm Dale Bruce. We're doing our practical for the Epilepsy Action Australia, administering midazolam intranasally via syringe. I've got the administration order here, medication, hand sanitizer, gloves, syringe, tissues and disposal bag. Our subject today is over here. We've just been sitting in the office chatting and they've had a seizure. For the purpose of the video, we're going to assume they're still having a seizure. I'm going to read through the administration order. Name, Frederick John Brown. Date of birth, 1st of the 4th, 92. No allergies, 84 kilos. Clear description of what the seizure for midazolam has been prescribed. Becomes stiff for a few seconds, cries out, will fall if standing. Rhythmic jerking of body and all limbs, will become pale, have extreme saliva, which may be blood-stained. Midazolam, when is it to be given? If the seizure lasts more than 5 minutes. Take a check on the time, 5:42. And when is the midazolam not to be given? If Fred has hit his head. Just going to have a quick check. No, he was on the couch. It hasn't hit his head at all. When can another dose of midazolam be given? If Fred has another seizure within 4 hours, I would check their epilepsy plan, data plan, to see if there's anything logged in the last 4 hours. There's been none. When to call an ambulance? Dial 000 as soon as the seizure starts. Can you call the ambulance for me, please?
Yep, of course.
Let them know where we are. When the midazolam is given, when to call ambulance. As soon as the seizure starts. Dose to be given, 5 milligrams, which is in 1 mil. Midazolam is available in 5 milligram 1 mils. How is it to be given? Either in the nose or inside the cheek. It's got the name of the prescribing doctor, their contact number, and the date was the 22nd of the 2nd, 24, which this order was published, and it's valid until the 22nd of the 2nd, 26, so we're still good to do that. We're going to now check the medication for the purpose of the video. This is the label that was provided that we have to put onto the medication. The medication is midazolam, 5 milligrams in 1 mil. PRN extended seizure over 5 minutes. Administer 5 milligrams per buccal or intranasal. Frederick J. Brown, and the expiry is the 12/25. So the date's good, the medication's good. You just got to check for the video. We've got the subject still having a seizure, so I've got to wash hands using sanitizer because I don't have access to tap. Rub up. Open up the medication. And we're going to double check that it was 5 milligrams in 1 mil. One mil medication. I'm going to put this straight in here to be disposed of. We're at 5, for the purposes of the video, we're at the 5 minute mark. We're going to now administer medication intranasally. Hey Frederick, I'm just going to give you some medication. This is going to make you feel better. Okay, so we're just going to make sure that the subject's nose is back. We're going to administer 2 to 3 drops in each nose. 2, 3, 2, 3. And then do it again to use up the rest of the medication. 2, 3. So we're going to wipe away any excess, and we're going to put the subject into the recovery position. We're going to monitor them. Put this away. That's rubbish. And we're going to continue to monitor them until the ambulance arrive. As she's stopped jerking, the skin's gone back to normal colour. The ambulance have arrived. We're going to write out what happened so that they're aware, the ambulance are well aware. We're going to document the date, the time, what the seizure looked like, how long, any injuries, and how much of the medication and what time it was given. What were they looking like before and after, and responsiveness. So there's been no responsiveness for the duration of the seizure, and now the ambulance will take over. I'd just like to bring attention to a couple of mistakes I made in that. When checking the medication, I should have ensured I checked it against the name on the top of the medication order. And when I was finished and wiped down and the ambulance came, I also should have added the gloves to the disposal bag to be disposed of. Thank you. Hi, I'm Dale Bruce, and today we're doing a practical video for administering midazolam through bucally via a pre-filled syringe. We've got the administration order, hand sanitizer, gloves, the pre-filled syringe that would come in the medication box. We've got tissue and disposal bag. Our subject today, Frederick, was sitting on the couch having a conversation and presenting with a seizure. For the purpose of the video, we're going to assume that the subject is still in a seizure. We're going to just put the subject in a recovery position just while I get this medication ready. We're going to read the administration order. It's Frederick John Brown, date of birth 1st to the 4th 92, no nil known allergies, 84 kilos. Clear description of the seizure for which midazolam is prescribed. Becomes stiff for a few seconds, usually cries out, will fall if standing. Rhythmic jerking of body and all limbs, will become pale and have excessive saliva. We've witnessed all of those things today, so we know that Frederick's having a seizure. When is midazolam to be given? If the seizure lasts longer than 5 minutes. Just looking at the time, it's 6:01. When is midazolam not to be given? If Fred has hit his head. We know that Fred was on the lounge, he's fallen, we've done a check, there's no head injury. We can administer another dose of midazolam if Fred has had another seizure. When can another dose of midazolam be given? If Fred has had another seizure after 4 hours. We've been with him for 5 hours today, we know he hasn't had any other seizures. When to call ambulance? As soon as the seizure starts. Can you call the ambos for me, please?
Yeah, of course.
Special services if you are unable to give the medication because of a head injury. There's no head injury, so we're going to be able to administer this medication. The dose to be given, 10 milligrams, which is in 1 ml in a pre-filled syringe, Xyamine. Midazolam is available in 10 milligrams in 1 milliliter. How is midazolam to be given? Inside the cheek, buccal. It's the name of the doctor, the contact number, his signature, and the date, 22nd of the 2nd, 2024, and the valid order's valid until 22nd of the 2nd, 26, so it's in order. We're going to check the medication. For the purpose of the video, we're using this as what was on the script for this box. It's Xanax midazolam, 10 milligrams in 1 milliliter, PRN extended seizure over 5 minutes, administer 10 milligrams per bucally route only. Frederick John Brown, we know that the administration order is him and we know the subject. and the expiry date is the 12th of 26. So we would open this container up, get ready to pull out the syringe. Again, using hand sanitizer, washing our hands as we don't have access to soap and water. Gloving up, and we take the syringe out of the container that we just seen. Have the tissue ready to go. Observe the subject. The subject, for the purpose of the video, is still having a seizure. We're still in the recovery position. We're going to check the time. It's now 6:06. It's been 5 minutes. We're going to administer the medication. We're going to let the subject know, hey, we're just going to give you some medication for your epilepsy. Hopefully it will stop with your seizure. We're going to do it through your mouth. So we're going to open up the cheek. We're going to put this in between the cheek and the teeth and slowly, over 4 to 5 seconds, put it in. We're going to wipe the rest of this off, and we're going to monitor them. The breathing appears normal. Colour in the skin has come back to normal. We're going to dispose of all this. The ambulance has arrived, and we're going to do some documentation while they do some checks and update them on what's going on. So we'll do our documentation. We're going to take out the date and the time. What did it look like? What did the seizure look like? How long did it last? Any first aid? Any the medication was given and the amount. So we document the times that we gave it. What did Frederick look like before and after? Their responsiveness before, during and after. They were non-responsive for the duration. What were they doing in the lead up, and their memory recall after. Thank you. Hi, I'm Dale Bruce. We're doing the video practical for administering midazolam bucally by syringe today. I've got an administration order, medication, hand sanitizer, gloves, syringe, tissues and disposal bag. Our subject today has just had a seizure. We're just taken into a recovery position. For the purpose, they're still having a seizure. I'm going to read the administration order from the doctor. It's Frederick John Brown, date of birth 1st of the 4th, 92, new allergies, 84 kilos. I know this person, so we know that this is something that we have to do. Clear description of the seizure for which midazolam has been prescribed. Becomes stiff for a few seconds, usually cries out, will fall when standing. Rhythmic jerking of body and all limbs. Will become pale, have excess saliva. When is midazolam to be given? If the seizure lasts longer than 5 minutes. So 5:53. When is midazolam not to be given? If Fred has hit his head, we're just going to do a quick check. He was on the couch, he's fallen to his side, there's no head damage. When can another dose of midazolam be given? If Fred has another seizure with 4 hours, I've been with him for 6 hours now, he hasn't had a seizure. When to call ambulance? As soon as the seizure begins. Can you call the ambos for me, please?
Yep, of course.
Any other special circumstances, if we're unable to give medication because of an injury, we're okay. Dose to be given, 5 milligrams in 1 mil. Midazolam is available in 5 milligrams, 1 mil. How is it to be given? Either in the nose or inside the cheek. And the name of the prescribing doctor, his contact number, the date, 22nd of the 2nd, 24, order valid until 25th of the 2nd, 26. So the order's still valid. We can see that the subject, for the purpose of the video, is still having a seizure. So we're going to administer the midazolam. when we get to the 5-minute mark. We're going to prep this medication. We're going to check the medication against the medication label. Midazolam, it's a 5 milligrams in 1 ml. PRN, extended seizure for 5 minutes. Over 5 minutes, administer 5 milligrams per buccal intranasally. Frederick John Brown, the order is for Frederick John Brown, and the expiry date is the 12th of 2025. So we're good for that. We'll wash our hands. Hand sanitizer because we don't have access to it. Soap and water. Glove up. Get our syringe. We're going to open the medication. It was opened in the previous one, just for your knowledge. We need to double check. It is 5 milligrams per 1 ml, so we're getting 1 ml of medication. I'm going to dispose of this stuff straight away. And we're going to be, for the purpose of the video, we've reached 5 minutes. We're going to administer this bucally today. We're going to make sure that subject's still in the recovery position. Hey, Frederick, we're going to just administer some medication. This is going to make you feel better. So we're administering it buccally, so we're putting it in the cheek, between the tooth and the cheek, and we're going to slowly, over 4 to 5 seconds, administer that. I'm going to wipe away any extra, and we're just going to monitor them until the ambulance comes. Their breathing's returned to normal. Skin looks not pale anymore, it's returned to a normal colour, but we're still going to keep them in that position. They're still non-responsive. The ambulance has just arrived. We're just going to document everything that's happened today and update you on those while we do. So we're going to document the date and time, how long the seizure, what the seizure looked like, how long it lasted, any first aid that was given, and the medication that was given, the time and the amount. The time it was given at 5:57, what they look like before and after, and what their responsiveness was before, during and after, what they were doing in the lead up to the event, and their memory after the recall, their recall memory. So they haven't actually come through yet, and they're with the ambulance. Thank you.